I'm Andrea Feller. I'm a pediatrician and public health physician here in Niagara. And, with that, our staff, myself, we've really been privileged actually in the last 5 months. We've been immersed in this work. We've been able to see how the virus works at the individual level, the group level, and the broad population level. And I think that, stepping back and thinking of the conversations I've had with so many parents and families and teachers that I know, it's important that we really remember how different it is when you're not immersed in it every day. And you're being asked to come back to work now. You're being asked to prepare in a very short amount of time for all your children that you care about so much and look after for their well-being, for their growth, their development, their learning in social, emotional, and all the areas, not just reading, writing, and arithmetic. Reading, writing, arithmetic as in the old days. So I really recognize that, and all of us recognize that and want to help and support you as much as possible. The other advantage a lot of us have is, for example, myself as a pediatrician, I have a really good comfort level in terms of coronaviruses with children. And this current one, as all the others, this current one, COVID, it can be dangerous for some children, absolutely. But in general, it's not so for the vast majority of children. And we saw this with SARS, and it was the exact same thing. And now we continue to see evidence that in addition to not being harmful for most children whatsoever, that children really are not likely to spread the disease nearly as well as we know adults do. So we have that reality. And then on the other hand, we know that school is critically important. Caring for children, whether they're in your family, they're at home, or they're in school, it's still caring for children and their well-being, whatever age they are. So the interpersonal skills, the teamwork, the emotional regulation, the social skills are just as important for their development as all of the cognitive education and learning that you do. And you know this better than I do. So putting those two together, then you're faced with a big dilemma, right? What do you do? So as the fall comes towards us, we do think that the choice was the right one to reopen schools. And what we want to do then is help guide all of you here locally within the guidance that the government has given, and leaning towards being precautionary, for sure, not taking unnecessary risks. What we're doing is working with all the schools, all the boards in Niagara to help all the leadership and staff know, out of all those areas that need to be implemented, what are the ones that if you have extra energy and time that you really want to invest the most effort in, because you need to know that from us. In the 5 months in Niagara, how can we make sure that you know, out of everything that we see that works and doesn't work, that you're investing in the most important areas, in addition to ensuring you've got all the basics down that the ministry is requiring. So with that reality and being able to focus in the very short amount of time, we are working with all of those groups I mentioned to share with them examples of the top 5 items to really focus on. And you might not be surprised to hear that they're largely focused on adults. And that is just a given at this point. We know that, sort of the top 3 things you could be doing really is really good screening of all the adults that are coming into the school setting. And we can't emphasize that enough in terms of our comfort with the knowledge that if you catch people at the earliest sign of a symptom, whether it's a headache, a mild sore throat, feeling more unwell than you expect just from all the anxiety and stress, those should not be disregarded. And those should be criteria to say, don't come in. And the leadership is there, the leadership at all the schools to say, you have the permission, we don't want you here, because it's one of those weird times where adults are more germy than children are. The other thing about it is we're all essential workers, right? And so I think about it almost the same as child development. The brain is wiring. Well, our brains have been rewired in a way so that when we have a mild sore throat or a runny nose or a bit of a headache, it's not that we ignore it, it's that we often aren't even consciously really aware of it because our brain has adjusted to the fact that we work through all of those things or we parent through all of those things. So that screening is a very critical opportunity to say, whoa, you might not have thought anything of it. You might not even have realized it. Let's check. Do you have any of these things? And so that's the top number 1, 2, and 3. Physical distancing is the other thing I want to mention. You'll hear a lot more in the sessions, but physical distancing, especially for adults, and I can't emphasize that enough. So our emergency child cares are a great example. They did a phenomenal job that they did that screening every single day, one-on-one, and then also the adults stayed away from each other and 2 meters from the children. So you'll hear a bit more about that as well because it raises a lot of questions. But all of the children that I saw over the summer, all the experience we had in the child cares, the children get used to it. And they say, okay, we stay away from Miss Marie, or we stay away from Mr. Brandt. And they understand that staying away is super important. It's important for children to have that distancing and the masks and the other things too, but it's much lower in terms of the impact it's going to have on preventing infections. So with that, really want to share with you that these things are happening. I wish I could be there individually to answer every single one of your questions. But knowing that school is so critically important for our children and that for the vast majority of children this fall, it is the best place for them to be. We want to make sure that if your questions are not answered, that you have an opportunity to let us know what they are, that we can answer them, and that you have a comfort level, that you get to a comfort level both with, the things you have to focus on. Because let's be honest, we've gotten to a place where everybody wears a mask now. Most people wear a mask over their nose and mouth. It took several months for that. But let's be honest, how many of you have that mask shoved in your pocket, in your glove compartment, hanging up? My cameraman is looking away, hanging off your rear view mirror. We have a long way to go. We don't turn into a mask-wearing society overnight. We're in that second stage now where our focus has to be on adults taking that mask off properly and storing it properly. It's either on your face properly or stored properly. So you can imagine with all of those things, the ability that we have to give you guidance on where to focus the most is going to be very helpful for you, because then you can reassure the parents and say, you know what, there will be cases. We know there will be cases. There's no risk option, but on balance, this is absolutely the best option moving forward, and we are doing it with the best available information and evidence to try and absolutely minimize any spread of COVID within the schools. And if it does happen, to be able to respond immediately and again, minimize any harms from that. So thank you again. There's nothing that can make this simple or easy or take away all of the anxiety. So I will say as well, look after yourselves, take care of yourselves, and thank you so much for what each and every one of you do for the families and children in Niagara.